Italy has recorded its lowest coronavirus death toll in 3 weeks yesterday. Have we started to see the flattening of the curve?
Well, I think that we are initially looking at a better scenario, but we must be very careful. I have really appreciated the words of Tony Fauci in the beginning of this program when he said that we can look probably at the reopening of many of the activities in the US, but the scenario is similar in other countries in May. However, we are looking at the better numbers in Italy since there has been a decline in the number of deaths. In the R0, the person that can transmit the infection is below 1. It means that we are on the right track, in the right road, but however, the sense of responsibility makes the difference. If we do not continue in the lockdown, or we do not preserve in the observation of the rules, we could destroy everything and we can go back to the very, very beginning. So we are on the right road, but we should remain with great sense of responsibility in these stick to these measures.
Now, Prime Minister Giuseppe Conte has extended the lockdown in place until the 3rd of May, but some measures have been relaxed. Certain stores, for instance, are allowed to remain open now. Is that a mistake? Should things not have been relaxed at all, given that we're looking at this positive trajectory?
Well, I think that there has been taken the right choice. When I was saying to remain stick to the lockdown, I was saying to have a general rule in the lockdown. Especially, I am looking at the sense of responsibility of my fellow citizen to stay at home, to wear masks, to wash their hands, to have the social distance. However, it's important to have the progressive reopening of some activities. And I fully agree what has been the choice of our government. And I think that this example will be followed by other governments in Europe, as well as probably in the US. When the curve is declining, and is it possible to have some sort of reduction in terms of infection? Is it possible to have some activities open according to a category of the activity? And of course, it's important to ensure the safety of the workers and the safety of those who will go to these activities.
You know, one of the things Dr. Anthony Fauci is saying in the United States is you can have a rolling re-entry of normal life, provided, the health authorities have the necessary infrastructure in place to not only identify infected people, but also isolate people that are infected. Here in Europe, we see a problem with not only testing people that have the coronavirus, but also down the line, potentially testing people who have had it in the past and who are asymptomatic.
Well, I totally agree with Tony Fauci. By the way, I worked with him many years ago when I was at NIH. This is a very wise approach, a very scientific approach. Right now, we have the nasal swab to identify the infected or the people who has coronavirus in their mucosa. But this is probably not easy to be done on a very large number of individuals. We are looking to the next step. The next step will be the definition of the presence of antibodies, IgM during the acute phase, and IgG class when to identify those individuals who has been in contact with coronavirus, and we can consider immune. Now, right now, there are no evidence, no experimental evidence that those who have the antibodies are protected. My personal view is that those who have IgG antibodies are protected. So we could probably look in the near future, not immediately now, but let's say in the forthcoming weeks and months, to identify those individuals who have the antibodies and who have who can be considered immune from coronavirus.
So is it safe to say, or I know that things are always changing when it comes to the coronavirus, that if somebody has had it or contracted it in the past, whether they were asymptomatic or not, that it's quite unlikely they will get it again, even though right now we are sort of worrying about the second wave, if you will?
Well, the second wave, it will involve those individuals who are not protected by the antibodies, and we do not know whether there will be a second wave in fall. However, if medicine remain the one that I have studied in the medical school, even though coronavirus, as you correctly was saying, give us always a surprise, but those individuals who has developed antibodies, they should be protected. And let me say, we are working, the science is working on the development of a vaccine. If the vaccine is given to the population, this will elicitate some specific antibodies. So the key for the protection of the population is the presence of antibodies. Is it true that right now we do not have any published or very few published papers on the protection exerted by antibodies? But it's reasonable to believe that the presence of antibodies will be enough to protect the people from a reinfection.
Roberto Cauda, we're going to have to leave it there. Thank you very much for joining us on France 24 today. And that's where we leave it. Thank you very much for watching.